With me tonight, Mr. Chad Martin from Martinsville, Virginia. And tonight we're going to talk about the affordable health care. The same thing as what? The Obamacare.
Right,
So many folks said, I don't like that Obamacare,
right,
but I'm really interested in affordable health care.
right.
And I was like, duh, same
It's the same
thing.
thing. Right.
Same thing. So, Chad, the lines will be open tonight. If you have any questions, you have myself and Chad, both of us are outreach workers for the Affordable Health Care Act. And if we can answer any questions, we got a few answers. Of course, um, the Health and Human Services right now is on shutdown because it's part of the federal government.
Right.
And so we're going to do our best to talk about and get everything out that we can possibly get out about the affordable health care tonight. Also, we're going to talk about the upcoming elections because it's going to be some hot elections, and especially with that governor's election.
Right.
It's going to be a really, really close election. Then you got so many delegates that are out here that's running.
Right.
So we just need everyone to get out on November the 5th and vote. Um, I had visited several campaign offices this week, or on last week, Danville, Martinsville. I was in one last night in Roanoke. Everything seems to be a bit slow.
Right.
That look like the momentum is not there. What do you think about it, Chad?
But first, let me touch on. It's funny you said that about the difference between, or what people think the difference are between Obamacare
Yeah,
and affordable health care.
right.
You probably was on that call too. We was on the call 3 Mondays ago with President Obama, and he actually told a story about a gentleman who is now on one of those exchanges, and actually said, "Yeah, I like this affordable health care, but I can't stand that Obamacare." And President Obama was very forthcoming and said, "You know what? I could care less about the credit. I'm just glad that one more person now has health care insurance."
Right.
And so it's coming that people actually realize that it's an actual a good thing. But looking at the election piece, I would never tell anybody who to vote for. Just the main thing is getting out there to vote, and it does seem like it's kind of a little bit dead. It's not as hype as it usually is.
Right.
Right. But there are some good candidates out there. I'm not gonna try to back anybody. I'm not getting paid to do that, and I'm definitely not a partisan person.
Yeah.
The main thing is for the people. I think the main thing is getting information, not just little infomercials, but actually getting what this person actually thinks and asking real issues and making sure they give you real answers.
Yeah. Well, it seems like the candidates are a little. You don't see them out and about.
Right.
Where are the candidates?
That's a good question.
I'm like, usually candidates are out at your churches knocking on doors. Do we have lazy? I hope they don't act the same way when they get to Richmond. Good evening and welcome to Star News. I'm Aruba Tommy.
Well, good evening, Tommy. How you doing? And to your guest, I didn't catch his name.
His name is Chad.
Chad?
Yeah, his name is Chad.
Chad, how you doing this evening?
How you doing, sir?
All right, I'm doing fine. Ruby, Tommy, I like the conversation you're coming up with tonight. And Ruby, Tommy, don't call my name out because you know who you're talking to. You're a good friend of yours, and we grew up in the same neighborhood.
Of course I do. And I won't
Yeah.
call your name.
All right, I thank you. Look here. Let's talk about the Obamacare.
Okay.
All right. You know, it's so sad that the House and the Senate, the House will sit down and pass this bill, and the Senate, they want to sit back and after they voted on it, and the sad part about it that Tommy and me, we discussed this last week that we don't want to call it the Obamacare, we want to call it the health care.
Okay.
And, you know, 85% of this health care plan is the Republicans. You know, they got everything they want in it. And it's so sad that John Boehner, when he made the vow to himself along with the Republican Party, that they kind of went left and right wing with the Tea Party.
Yeah. Now, do you feel that the affordable health care, do you think it will help people in this area or all areas?
Well, you know, I'll be honest with you. You know, we are the only nation in the whole world that don't have health care for all citizens of their country.
Yes.
We're the only one. You know, we got Mexico and South America and Canada has free health care. And we don't want to go over the ocean far as the Pacific and the Atlantic and the Arctic. We don't need to go over the ocean. But let's look at the continent that we are surrounded with. And for those of you all who don't know your global history, that we got Canada, South America, and Mexico.
Okay.
All those countries and over the ocean, as you would say, my body rolled over the ocean, that they got free health care.
Okay. Now, do you have a question about the? Do you have any question about the Obamacare?
I don't have a question. My question is this: when you took the Democratic Party and the Republican Party, they sat down and like I said earlier, before you cut me off with about this question, that 80% of the Obamacare came from the Republican Party. You know, after this second election, President Obama sat down with Nick Romney.
Yes.
And they came up with all of this plan. And the Republican Party voted on that. Now, they want to hold it. Now, what I was trying to say earlier, that John Boehner, he did a statement that...
All right, turn it up. We got calls waiting.
I know we do. He did a swear thing that Obama would never be a second-term president. At the same time, he also did a thing that we're not going to let any bills that he won't pass.
Okay. That's right. Thank you so much. Thank you so much. And we'll talk.
Well, with the Obamacare, I have things I have. So why do we need to sit down and talk with the Republican Party?
I understand. I'll talk to you later, Michael. But look, that's what so many folks are talking about.
Right.
They are really talking about, no one expected President Obama to win the second term.
Mm-hmm.
So they had planned to throw this out. But now it's a law.
Right. Supreme Court has passed it. Right.
Supreme Court has passed this. It's a law.
Right.
So what are you going to do? So they're going to overlook what the Supreme Court? That's the highest court in the land, isn't it?
Right. And the interesting thing is, and that's why I'm real big on people getting their own research. Even though the Supreme Court passed it, they did leave state, they gave them the opportunity to say if you wanted to expand Medicaid. And Virginia said no. And so we are one of those states that didn't expand Medicaid, but we will be on that exchange program January 1st.
January 1st.
Mm-hmm.
Good evening. Welcome to Star News.
Yeah, how you doing today, there?
I feel good all over. How you doing today?
In your company there too. How you doing?
How you doing, son?
Yeah, I just want to bring this to everybody. Y'all know the reason this stuff is keep on repeating history. These people, at the end of the day, they contend to each other. And this is the Democrats they some kin to each other and the Republicans they some kin to each other. And all this country is a thing that a lot of stuff are called reality exists. It's called maturity exists, called purity that exists around all of us. And we keep on just going through the system. We know that law and justice is supposed to be the order of us and the rules of us, but we keep allowing stuff that we know exists to keep coming and playing with something that's so important to us called order in a situation of life that we done been through and we done been there and we know what our problems are and we got to stay obtaining and maintain. And that's what these positions is based on from the House of Republicans, from the House of Democrats. All of these positions is based on keeping order in this country, in away, in safety and security, in the surrounding borders, keeping us safe and secure from the same thing that we exist within us. It's the same thing that exists outside of us. It's normal circumstance. You got hatred, you got angerness, you got selfishness, you got all that, and that's what justice in government is supposed to be all about. It's maintaining and obtaining that, but it's just start selling out. It's a sellout. It's a big thing where people just playing powers, where we can sit right there and we can do this with so many people and we can do that with so many people. But you can't do nothing with somebody that's mature. When people are mature, when you got focus and sensibility and you comprehend and you acknowledge and you know real religion, you know real life, you know real government, you know real laws, and that's what you live by. That's your class and that's your style. You walk in religion and you walk in justice. So you can't play this game that they play because it's going to cause bad weather and it's going to cause intelligence because you're playing with intelligence.
All right.
And then you're going to have some kind of Armageddon type of lifestyle going on while people just going to start hitting. You got to have order. Somebody got a rule, and what's supposed to be our rule is justice. Justice is supposed to rule the racism that we are all capable of being, the mafia, the organized crime. That's what government and religion is all about, balance and leverage, understanding and intelligence. And that's what the business is supposed to be. We don't supposed to be back and forth talking about what somebody doing. That's what they get paid to do, is do a job, a good job.
That's it. I appreciate you calling.
All our life. It's getting old.
Yes, and I really appreciate you calling. He had a good point there. Now, Chad, I know you're one of the outreach workers, including myself. If someone was calling and needed some help or know exactly what to do, where to go with the marketplace, I know the lines were jammed up last week, which was a good thing because that shows you that the 48 million folks who are without health care, they are trying to get health care, and they across every state, lines are jammed up. So where can a person call?
The good things are there are people that want to give that information to people, because right now this is a good time to where people can research and find out what's the best policy for them and their families. And so Contact Listen Line has just received a grant. They're 24-hour, 365. There'll always be somebody there. It's 1-877-WE-HELP-6. 1-877-WE-HELP-6. And then too, there's a national number, just in case there are persons who speak different languages. That number is 1-800-318-2596. And they have interpreters of every language there to be able to handle and just give you best case scenarios, best policies. There's another good website that I was actually just researching, and it's not partisan. They don't receive money from anybody. Consumer Reports just gave them an okay because they don't accept money. They don't accept anything in return, so it's strictly for the people.
Right.
And that's healthlawhelper.org. And you can go on there and plug in your information, and it can be all private, and they'll give you some choices that might fit your family lifestyle just for you, and it's all anonymous.
Okay, wonderful. Because I know I got a lot of calls because people were calling the congressional offices, which right now they're closed. They're shut down right now. They were calling the Senate office. They called Tim Kaine, has just opened a new office here in Danville. It's closed. So right now people just don't know where to go, what to do with the shutdown and the whole works. So, caller, if you will hold on, we're going to break right now, and I would love to take your call, okay?
Okay.
All right.
Tommy.
Hold on, and we'll go on to a commercial, pay some bills, and we'll be right back with Star News and with the affordable health care.
You're watching Star News, the news leader in Southside Virginia.
Beat the heat! Air conditioners starting at $60. Cool your ride down with rims starting at $175. Keep your knees in the breeze and stay cool on scooters starting at $800 here at Pawn America. Now what could be cooler than all of this ice? Diamond rings starting at $149. Beat the heat and stay cool with these prices here at Pawn Shops America, 1380 Piney Forest Road, 836-0101. Give us a call.
I'd love to change careers, but I have to go back to school and learn new skills.
Danville Community College has programs to teach whatever skills you need.
Well, how would I pay for it?
They offer some financial assistance, like that new grant for students in the Product Design and Development program. It pays for tuition and books.
Oh!
You'll learn how to use computer-controlled equipment to design and produce new products and earn an associate's degree. You can take the classes at the Danville campus or at the Southern Virginia Higher Education Center in South Boston. Just call DCC at 434-797-8565 or contact the Higher Education Center, 434-572-5505.
Thanks, man. I'll do that.
Safe Driving School of the Piedmont has new summer classes. Driver's training in the classroom, behind the wheel, and driver improvement. Driver's training class offers homeschool, private school, third-time failures, and just folks needing help. Safe Driving School of the Piedmont, behind the wheel, with no waiting list, and they always have room. Call 434-791-2223 or 434-441-1087. Or you can email rickyfugate40@yahoo.com.
Hello, I'm Phil Gardner, and when I'm not in the courtroom, my idea of relaxing and having a good time is working out here on my farm. If what you do to relax and have a good time has been ruined by injuries you've received in a motor vehicle accident, give us a call. We know what to do to help you.
Shoppers, it's the event you've been waiting for. It's the 10 for 10. 10 for 10 is back again. The young and the old, they're excited about these Pringles stovetop stuffers. You've got hot dogs, bacon, Lunchables, Gwaltney sausage, pizza rolls. You have orange juice, biscuits, lettuce, vegetables, Sunny D juice. You have Hawaiian punch, mushrooms, Totino's pizza. I tell you, you cannot beat this at Save-A-Lot on Piney Forest Road. This is Lauren, the Saving Maven Hudson. You got baby carrots. You got Chef Boyardee. Look at her. She just can't contain herself. This is the sale you've been waiting for. The sale you've been waiting for. Okay, come on in. I will see you there. Don't forget your coupons. It is 10 for 10 at Save-A-Lot on Piney Forest Road. Come on in. I'll meet you there. Don't forget your coupons. 10 for 10. 10 for 10. 10 for 10. 10 for 10.
There are hundreds of new items and new lower prices. Stop by the newly renovated Save-A-Lot, Piney Forest Road, Danville.
Hello, Danville viewers. My name is Phil Gardner. I'm an attorney with the firm of Gardner, Barrow, Sharp & Reynolds with offices at Piney Forest Road in Danville, Virginia, and I'm pleased to announce a new show that will be on WMDV Comcast 16 and Chat Moss 15 at Monday night, 8 o'clock. It's a call-in show. We'll be trying to answer any questions you have about law or business or any other matter you think a lawyer might be able to give you useful information about. It's a public service, and we would welcome seeing you and taking your calls.
You're watching Star News, the news leader in Southside Virginia.
so glad to have my guest here tonight, Mr. Chad Martin from Martinsville. So, with your last name, Martin, do you own part of Martinsville?
No, I think there's another story behind that.
So that's another story behind
Yeah, I
that.
think that-
Because you know, between the Harrisons, the Martins, and the Wilsons, they got all of that taken care of. That area is well.
That was a big plantation.
So
area.
that's a big plan. So we have to do another story on that.
Mhm.
Hello, caller.
Good evening, Tommy. Good evening, Chad.
Good evening. How you doing?
Good. I can say that I've been monitoring this healthcare.gov, this Obamacare Affordable Health Care Act in the last week. The state of California alone had 7 million hits in 1 week. Florida had 2 million. Upstate New York had 2.8 million. So we know that there is a huge interest just in the past couple of days when the program started last Tuesday for people trying to buy insurance. So I said that to lead into, if you don't have insurance and you've got a part-time job or you have insurance, whoever you are out there, don't be discouraged. Don't be discouraged by the shutdown because the funding is already there for Obamacare. And get on that market exchange, healthcare.gov, and research some insurance. Make an application because you've got until January 1 to have your insurance in place.
Right.
And I'm saying that, Tommy, because a lot of people don't have the oomph or the wherewithal to go forward. They get turned around by what people say.
That's so true.
Let's don't get turned around. Let's go get some insurance, and you'll find that it's more affordable than you think. And if you don't meet the income qualifications, you get subsidies, which will help to pay for your insurance. And I'll say this secondly. If you're out there thinking you won't get sick, you're the one that needs insurance, okay?
That's right.
I want to say this, Tommy, and I heard you, I'm going to feed off something you said last week. This shutdown, this government shutdown, and I'll get off, is nothing but massive resistance from the 1950s and the 1960s. It's the same old folks, same old playbook, okay?
That's correct.
And I'm old enough to remember what that playbook was all through the 1950s, 60s, and 70s. Same old folks, same old playbook. But having said that, I want to encourage people to realize tonight that the Tea Party is on the wrong side of history. And those who would take us back to 1950s are on the wrong side of history. The population is going forward. I just heard numbers yesterday that in the marketplace, in the next 20 to 30 years, the marketplace will get 50 million new employees to pay taxes, Medicare and Social Security, and to pay income tax. So for those of you who would think that this country is going down the tube, it's a myth. Okay?
Yes.
It's a myth. And immigration has provided us a wealth of talent from India, Afghanistan, Pakistan, Europe, South America. So America will continue to be that bright light, and I think it will even be greater because of the demographics. So, Tom, I really want to say this. I would like Chad, he gave a number, a 877 number, which is a 24/7 contact line,
Right.
to give it out, because I didn't hear the last part of it that clearly.
Okay,
And
I'll make sure he repeats that again.
And I'm going to get off the phone, but I think it needs to be said.
Okay. Oh, we're going to make sure that this number gets out tonight.
Absolutely. People in the South, get off your stools and get going and go and meet the future, because you're on the right side of change if you help yourself. But if you get discouraged by what people say, you're on the wrong side of change. So let's be on the right side of change and on the right side of history. Tommy, have a nice evening.
Thank you so much.
Okay.
Now, Chad, we're definitely going to give the numbers again, but she was saying that how many folks that has already signed up. So that tells you right there it's a need.
Right. It is.
So right here in the city of Danville, Martinsville, this whole general area, you know, the election is coming up.
Right.
Why can't we get our elected officials to come to the desk? Is it they don't know about the affordable? They don't know enough about it? Are they afraid of not winning or losing their seats? Or what is this?
Well, the funny thing is, the affordable health care is a determining piece or a voting piece, and so and I'm definitely not telling anybody to vote for anybody, but even McAuliffe says yes, he will receive debt to come to Virginia, while his opponent is actually saying no, he's going to try to fight it. And so, just not on any party lines, but if Virginia says no to this affordable health care coming, Virginia's going to have to end up paying close to around $25 million back to the federal government. And so
Right, because we will have the federal help, but we won't have help from the state.
So I think that's interesting, and I'm so glad the young lady said, as well as what you said. Voltaire said something. He said, "So long as the people fail to exercise their rights of freedom, those who wish to tyrannize will do so. For tyrants are active in art, devote themselves in the name of many gods, religious or otherwise, to put shackles upon sleeping men." And so I'm glad she said that we have to start standing up, and what you said about start demanding, especially during election time. This is when people need to realize how powerful we are. We want you to say where you stand on all these issues.
Yeah.
We need you to start coming out and actually talking to us.
I could care less whether you're a Democrat, Republican, or Independent. I could care less. But what I care about, that I have friends, godmothers, and all who are senior citizens. They need to know. They need to be. They need to know that their Medicare and their Medicaid and their insurance are taken care of. You got so many young kids are going to school. You got to have your health care in place. And early detection leads to early correction.
Exactly.
You got so many folks. You just read the obituaries and see how many folks are dying now in their 30s and 40s and 50s of just not going to the doctor.
Because they didn't have the money.
They didn't have the money, didn't have any insurance, and you can't continue to use the emergency room like it's a doctor's office.
And the scary thing is, a lot of people that I heard that were against the Affordable Health Care Act, when we actually sat down and talked to them, 2009 we knocked on probably about 175,000 doors, and probably about 80% of the people said they wanted health care reform. But when you're knocking on doors and then some of these people say, no, I don't want it. And I was like, well, do you realize who ends up paying when somebody utilizes the emergency room and they don't have the money to pay for it? Do you realize who ends up paying in the long run?
Yeah, you.
You do.
That's right.
And so, and we were knocking on doors, and you talked about older people. We knocked on doors, and it was the worst stories in the world. You have older people talking about they either can't buy their medicine, or either they don't buy food, which some of the medicine you have to have food. And we have people right here in Danville that was talking about they were eating dog food just so they could afford their medicine. That is so. That's a shame. That as rich as we are, as this country, that we don't have. I was hanging out with some friends from Canada. They all had a health care card in their pocket with their picture, just like a driver's license. I was like, look how close. Just right up the street to Canada. They all got health care. So that's I just can't see Boehner and all these folks on the opposite side that you would hate this president. They like the point that we have health care, but they hate the point of who brought it here and made it happen. Because so many presidents have tried, but President Obama made it happen. And so they were like, you are not, number one, you weren't supposed to get a second term. Number two, you think you're going to go out of office with this great accomplishment under your belt? So, Chad, give us those numbers again. Okay, definitely want to give that. And so, Contact is like a local line. They service Martinsville, Henry County, Pennsylvania County, Danville, Patrick County area. And that's a 24-hour hotline, somebody that's trained there to listen and actually be able to help. So that number is 1-877-WE-HELP-6. 1-877-WE-HELP-6. And then there's a national number, just because we have such a diverse community.
Yes.
There's a national number. It's 1-800-318-2596, and those persons are trained to get you to the right interpreter.
Okay.
To make sure that you can get the information in a way that you understand it.
Now, what about what are the two? What is it? 2 or 3 companies
In this area.
in this area that we have to choose?
And that's a good question. And if you go on that Health Law Helper, it actually shows some of those exchange companies that will start giving
From the marketplace.
From the marketplace, right. And then too, if you already have your own insurance, then you can stay on that. But I would say make sure you research, especially if you're getting it through the company. It should have been given out October 1st if your employer is going to take away or keep you on the same healthcare insurance. And so that's something to be very mindful of for those people
Right.
who do have
And be
those.
very careful about who, because no one should be calling you.
Right.
You don't have to give out any of your personal information to anyone you know anything about. And if you already got insurance and you're satisfied with the insurance, stay on it. You don't need to call anybody. You good to go.
Right.
But there are so many people out there don't have anything. Don't have any insurance whatsoever.
Mm-hmm.
Now, what's going on in Martinsville?
In what aspect? There's
What's going on since you 30 miles away? Tell me. Well, we're gonna get to that because we want to know just right up the road what's going on in the healthcare and what's going on in Contact. Good evening.
Good evening. How are you?
I feel good all over. How you doing?
I'm doing all right. I just wanted to discuss and ask a question about the cost because I went to the hospital, to the emergency room, and I got a bill that listed all the charges and stuff like that. And I got the bill, it was almost $1,500. And the doctor's cost by itself was almost $900. And I talked to him for about 15 minutes, and he took about another 5 to 10 minutes on a computer. And I'm saying, this Obamacare or the ACA is going to take care of that too, because these costs it has within certain guidelines. Am I right?
Now, I can't answer that. I don't understand. Did you sign up for the affordable health care?
No, this was an emergency. Actually, I'm a veteran, and I get my health care through the VA. But because this was an emergency, that's the bill that I got. And I understand that when you have insurance pays a certain guideline of cost for certain things. And people who go without insurance end up paying more for the same services because they have to make up, or whatever reason, they
Okay.
pay more.
I understand your question. Now, this is what I want you to do. I want you to take your bill, take it to the hospital, to the billing office. Get the hospital to explain to you what portion that your insurance would pay, what portion that you would have to pay. But you will have to find out from that facility which I don't know which emergency room you had gone to, but that's what you will have to do.
Yeah, it was the Danville Hospital right here.
Okay. At the Danville Regional Hospital, they have some very nice people there in their billing office. Take your...
Yeah, like I said, I'm a veteran, okay, and the only reason I had gone there, and this was a long time ago.
You went there because you couldn't get to the VA.
Because the VA hospitals are far away and the clinic was closed at the time.
Okay, I understand.
But I'm just, the bill, this was about 2 or 3 years ago, and the bill was taken care of. I'm just asking if in this Obamacare, which I understand when you have private insurance, that they have to go by certain guidelines, like Medicare pays a certain amount, and Medicaid pays a certain amount for certain services, that, this Obamacare will cover the same thing because these guidelines also are covered when you have private insurance.
Now,
Anyway,
from what we were taught, that the Obamacare will cover emergency room, medication, doctor's coverage. It will cover anything that any insurance will cover.
And the good thing about the exchanges, before certain private healthcare insurances said we'll only cover certain things like emergency room or something like this. Now with this exchange, they have to cover the whole gamut.
The whole
gamut. So
right.
medication,
emergency care.
checks. And the beautiful thing about this is it's on the preventative side.
Right.
And so it's getting you to go to the hospital before a problem actually comes.
That's so true.
And so that's what the beautiful thing about this, because prevention is a whole lot cheaper.
A whole lot cheaper.
Right.
If you just go in for physical. We're going once again to a commercial, Chad, and when we come back, we're going to talk about Contact, Martinsville. We're going to talk about everything tonight, and everybody.
You're watching Star News, the news leader in Southside Virginia.
Hello, I'm Phil Gardner. When I'm not in the courtroom, this is what I do to relax. If what you do to have fun and relax has been ruined by injuries you've received in a motor vehicle accident, give us a call. We know what to do to help you.
Gardner, Barra, and Shaw in Martinsville and Danville.
I'm Pastor Will Robinson at Soul Winners International Ministries in Martinsville, Virginia. We're just real people. Sometimes we have real problems, but thankfully we serve a real God. At Soul Winners, we are a full gospel-believing, non-denominational, Jesus-focused ministry. We invite you to visit with us for Bible studies on Wednesday nights at 6:30 p.m. or for Sunday morning worship at 11 a.m. or watch our broadcast on any Star News station. Join us at Soul Winners, where every member is called to win souls.
With 20 years of service in law enforcement, 4 as the sheriff of the city of Danville, Mike Mondole is a proven leader. Not only because of the advances made to the sheriff's office during one of the toughest economic times in our nation's history, but also for the dedication to our youth and community. The city of Danville needs leaders who are firm, fair, and get the job done. And Mike Mondole has proven that he is one of those leaders.
I'm Sheriff Mike Mondole. I'd appreciate your vote on November the 5th.
It's that time of year again. It's customer appreciation time at Lee's Tire and Wheels, and we're going to prove it. October 3rd, 4th, and 5th. Mark your calendars now. If you've got to dig into your life savings, your inheritance, or even your 401k, you're definitely not going to want to miss this. On top of that, lunch is on us. October 3rd, 4th, and 5th. Chick-fil-A, hot dogs, you name it. Come and check us out for our customer appreciation sale. 302 East Church Street, Uptown Martinsville, 24112, or give us a call, 276-638-3240. Get it at Lee's.
If your family is in need of a caring professional to assist with everyday tasks for your loved one, you can trust the staff at Peacehaven Health. Peacehaven Health is now accepting new clients. Our services include bathing, dressing, light housekeeping, cooking, respite services, temporary live-in, medication reminders, supervision, and more. At Peacehaven, we offer home health care for any budget. Reliable, honest, caring, capable, and dependable. At Peacehaven, we care for you and your loved ones. 434-799-5731, serving Southside Virginia. Peacehaven Health Systems.
Hi there. I'm Dr. Isaac Hill, Danville's new chiropractor. I'm located on Mount Cross Road, across from Outback Steakhouse. Are you experiencing any headaches, migraines, neck pain, shoulder pain, numbness and tingling in the hands, low back pain, sciatic pain? Have you been in a car accident? If you have, I want to see you today. My location is on Mount Cross Road, across from Outback Steakhouse. Call me at 434-797-4455.
You're watching Star News, the news leader in Southside Virginia.
We're back, and all the lines are lighting up. And if you got a question about the affordable health care, give us a call at 434-549-8548. Chad and I are right here. We are outreach workers and ambassadors for the affordable health care, and we're here trying to help everybody. Right in Danville, you can go to the Department of Social Services, see Faye Brown, and Faye Brown has a lot of information. She gave out some information at church a couple of weeks ago at the Bible Way Worldwide Church, and Faye Brown has some great information on the affordable health care right here in Danville at the Department of Social Services. So I'm sure if she has it at Social Services here, they have it at Social Service at Martinsville as well. And any local office, and some of the insurance offices may have some information, but get the information and find out which plan fit you better, and we'll move forward from there. Now, Chad, what's going on? Any announcements? Anything you need to make? What's going up in the Martinsville area?
Well, just basically that, and even with Danville too, PATH, along with another group, are also working to get that information out as well. Just at the Institute last week, had a meeting with the Danville Hospital, PATH, and also the national coordinator for all the free clinics and whatnot, and just all the different work that they're doing.
I really like the work that the Danville Free Clinic is doing. They're doing some great work over at the Free Clinic for those who really need some health care and that really don't have to utilize a doctor's office. That it's a free clinic that's right here in the city. Now, do you have a free clinic?
Yeah, we have urgent care, which is in Martinsville. It's the free clinic.
It's a free clinic in Martinsville. Okay, wonderful. So, you know, just 30 miles apart, it's so good that great neighbors have, because, you know, Martinsville used to be my old stomping grounds back in the day. I love Martinsville with the June German Ball.
German Ball.
Yeah.
Yes, sir.
Wait, is Clarence Carter still around?
Oh. Not in Martinsville, he's not.
Is that not in Martinsville?
He's hiding out. Oh,
yeah.
Man.
Well, we definitely could have used him last weekend here in Danville because they didn't have any, basically any talent for our River District Festival. Well, the main attraction didn't show up, so that was a letdown for the city. Compared to the year before where we had Dougie Fresh, and the year before that, Kelly Price, and then this year, zero.
Oh, wow.
So it just lets you know, are we going forward or are we going backwards?
I think we're going forward. Sometimes change happens in cycles, and so you can appear to be going forward at first, and then it'll take a step back or two, and then you start moving 3, 4, 5 steps ahead, and then you get knocked back down, just as long as you keep pushing forward.
Yeah. So you all had a festival up in Martinsville as well.
Oktoberfest.
How was that?
I think it was a beautiful event. And that's what I love about events like that. Danville's known as the city of churches. You got 500, 600 churches. Martinsville, you got about 200 or 300. But we also have like 203 nonprofits. But when all of them finally set aside their pride, set aside their ego, and come together for one big event to help the area, it's a beautiful thing.
Oh, yeah. Because, you know, everybody, I was in Roanoke over the weekend, and, you know, I was in discussion, and, you know, people say it's a Bible Belt, but
definitely is.
It's but if this is a Bible Belt, why so many people hate each other?
Well,
I didn't think they taught hate in the Bible Belt.
Well, it's one thing to be the Bible Belt, but it's one thing to actually have the scriptures in your heart.
Oh, yes. Hello, caller. Good evening. Good evening once, good evening twice. So that's what we get. I just know that, you know, I know they always say it's the Bible Belt and people get along, but I just have problems. Church people, to me, are some of the worst people I ever met. Good evening.
Good evening, Tommy. And once again, I'm calling back.
Yeah.
You know, Tommy, we were talking about this health care plan, and I know y'all talking about the Bible Belt. Now, like you have an immigrant on your show tonight, and we're talking about the world. Most foreign countries have free health care plan. I would like to hear your guest to explain the free health care plan.
You said he was a what? An immigrant?
Well, I mean, he looked like an Arab to me.
He's a soul brother.
He's a what?
He's a brother. He's a brother from Martinsville.
You know something? He was a brother from Martinsville, and we had an outbreak of a war. I would have shot him on the spot if I heard. I'll be personally honest with you. I will give you the first one to say that I apologize.
Yeah,
It's okay.
I think he played football at Alberthurst, didn't he?
The students at school. The students at school joke about that.
I got a nice 60 hit the LT.
Well, if he look, well, what do I look like?
Like Tommy Bennett. Look, fool, don't go like that. All my life. But no offense, I would apologize to you, but you does look like an Arab.
That's all right.
Like the guy from the convenience store.
But at the same time, an Arab can be an American as well, so don't ever mistake.
Well, I believe that. I also believe that as strongly, you know, I support that the immigrants that came. Well, I mean, hey, me and Tommy are not. I mean, we are Americans, but as far as Tommy and our ancestors came over here slaves as well as the white man. They came over here and immigrated. The only true Americans are the Indians.
Native Americans,
everybody else from there are immigrants, but we are sons and daughters of immigrants that make us Native Americans. So I agree with that on that part. But as far as this health care plan, you know, I think the Republican Party is being real ignorant about it. And, you know, Tommy, I heard a thing that John Boehner did last Thursday that he said that the American citizens was upset about the government and shut down. He's the one that shut it down. He shut it down. And like I said earlier, that the health care plan, you know, 80% of it comes from the Republican plan.
I understand. And I thank you. We got some other calls waiting. But look, I can understand how these folks are continuing to win their seats back.
Right.
Now maybe this will be a wake-up call, but what districts? That's one of the reasons they're continuing to change the district lines and now enforcing and placing laws on the voter registration. So that these folks can win, because they see now that we are voting and we are voting in blocks and we are going out and knocking doors and getting folks in telephone calls and getting folks to vote. Now let's change the laws, because your child could be at any school and could vote at that school using your home address. What is this about?
It's about power. When you can change around certain districts to make sure that you can make sure that you win an election. It's interesting that you say this, because actually I want to say around 2010, 2011, even in Danville, right there around $1 Million Alley Road, right there where the Confederate White House is, I think that used to be one of the voting districts for African Americans.
Yeah.
And so to have that.
And that was at the corner of Main and Harbor.
Right. And so to have that, some African Americans didn't want to go there, and certain people knew that. And so you have to make sure that you're paying attention to what's going on in the area. Also, just to show you how powerful voting is, 1901, 1902, a Virginia Assemblyman House of Delegates actually said, let's create a felony system to keep the darky out of the political system. And so if we know that somebody wants to keep you out of the political system, it should be 10 times more important that you get out there, register to vote, and that you don't fall behind a felony system. So you're not out there selling drugs, so you're not out there hurting anybody, so you're not out there carrying illegal weapons or anything
Right.
of that nature. So you can make sure that you can vote. And so I think it's real important that we make sure we do.
Yeah, and changing the voting laws, I was like, you know, and I talked to some of the politicians that was like, well, Tommy, what's wrong with everybody having an ID? Yeah, so what? But you're putting all these laws in place just like it's a problem. There hadn't been any problems at the voting polls. But now you're creating problems.
And good thing Virginia turned it down as well, about having those certain restrictions and whatnot.
Yeah. Now, one thing I can say about the governor of Virginia right now, he has pardoned and has given the rights back to a lot of convicted felons and folks who weren't able to vote. He has definitely signed off to give them the rights back. And we just had a meeting a couple of weeks ago at Danville at the legal aid office, and we got folks in town, and you can get your rights back. If they got booklets and the laws have changed, you can go by the Danville legal aid office, and I don't know where you can go in Martinsville.
Well, you can go right online. And Tim Kaine kind of started this. He because it was like a long process, and so he separated the nonviolent to the violent. And so the nonviolent application is one page. It's very small little paragraphs that you fill out, your name and whatnot, and you get a notary public to sign it, and you send it off to Richmond. Whereas the violent application is about 16 pages. It's been a big misconception that you need a lawyer to do this. You don't.
Right.
You don't.
You do not need a lawyer to get your rights back.
You can do this free
You
of
can
charge.
do
Right.
free of charge, because when I was living in Chicago, there were attorneys coming to my office saying, and these folks were paying $4,000 and $5,000 to get their rights back so they can vote. And I was like, no, you can do this free. And I know in Chicago it was like $35 the application fee, but here I don't even think you pay that.
No.
You can just fill it out,
And send it to
get a
Richmond.
notary, and notaries don't even charge you nothing now. So you can really get your rights back, so you can get a better job, and you can vote.
You can vote.
And so that's what this is about. It's the affordable health care vote on November the 5th. I want everyone, as the minister said, everyone under the sound of my voice, get out and vote. I don't care who you vote for, but you need to vote on November the 5th. It's I know it's not the presidential election year, but guess what? This election is more important than,
Oftentimes they are.
yeah, because the president got to have somebody to work with him. That's the reason we're in the bind that we're in with the shutdown today, because of folks are not getting out to vote. Hello, caller. Hello. So, yeah, so many folks.
And then too, even after you vote, I think we do a disservice when people say get out to vote, and then don't say hold our officials accountable. Even after you vote, there's still some work to be done to make sure you hold your public officials accountable. Yes, you voted them in, and then you want to go ahead and let them know, I'm still watching what you're doing, and I'm still holding you accountable to what you said you were
You
going to do.
got to hold them. They run on, they'll come out to your church, they'll shake your hand, they'll tell you everything, and you will not see that person again until election time again. That one spoke. Good evening, caller.
All right, we're talking about getting your rights back to vote, and you're talking about violent crime and non-violent crime.
Right.
Now, let's talk about the violent crimes. Now, would you say distributing drugs is a violent crime, distributing drugs, and compared to a non-violent crime is selling drugs? It's a non-violent crime. Now, come on.
No. And again,
Drug possession.
And again, this is not me. This is not Chad Martin that created this process. And so once you go on the website, you'll look, and it has a list on both the forms.
I have that book with that list.
Like on the application process, it says what is constituted as a violent and what's constituted as a non-violent felony. And so by those guidelines, that's what you have to go by to get your voting rights back.
Yeah, but if you look at the guidelines and you look at certain crimes,
right?
Okay, breaking into a home before 12 o'clock p.m., that is called breaking and enter. Breaking into a home after 12 o'clock p.m. is called breaking and enter. But now, they also got it as after p.m., breaking into a home is committing a crime, committing a rape, or committing, if you do the committing of a violent act, rape or murder. But if those crimes do not commit rape or murder, but after 12 o'clock p.m., that's a violent crime. So what is the difference if you break into a home at 12 o'clock p.m. and you don't rape nor kill? What is the difference between...
Okay, I understand your question, but you know what? We're going to save that for a different show. Chad, before we go, let's give those numbers. If you need help with the affordable health care, Chad, give those numbers.
And so the number for contact, which is good for this area, is 24-hour hotline, 1-877-WE-HELP-6. That's 1-877-WE-HELP-6. And then the national number, just in case if there are those persons who speak different languages and need a little bit of help understanding and interpreting, it's 1-800-318-2596. 1-800-318-2596.
I'm telling you, we're right here. If you can't find myself or Chad, that just like he said, it's a 24-hour hotline and a contact right out of Martinsville. And we're here to help. And sure, we may not have all the answers, but we will get the answers for you. There are so many places we can call, and there are so many places right now that are on shutdown, that the Health and Human Services Office and a few other folks where we were calling to the congressional office. I have a problem with a young lady today, had some problems with mental health, and want to call Tim Kane's office, and couldn't because the local office here in Danville is closed. So we're going through it, but it won't be shut down always. So just hold those thoughts and hold those questions, and we're going to get out of here. Chad, I thank you so much for coming down and helping us out. And it's going to be a good week. We're going to get everybody signed up in this area. Danville, Martinsville, Roanoke, Chatham, wherever you live. You will have health care. And you're looking at your outreach workers here, and just thank you so much. Vote, and the choice is yours. Don't vote, and the choice is theirs. Good night.
You're watching Star News, the news leader in Southside, Virginia.